So our next topic of discussion, while it's not one that probably comes up very often in normal, regular conversation, it is one that is important to address: hospice care.
Yeah, what first comes to mind when you think of hospice care? That all hope is lost? That you have to admit your loved ones to an uncomfortable facility? You see, that's why it's important to have this conversation today, so that in your hour of need, you know exactly what to expect. And here to help today is the president of Coastal Hospice, Elaine Capon. Thank you for being here this afternoon.
Thanks for inviting me.
So this is all very timely, as November is Hospice Month.
Yes, it is.
Why do you think it's so important to educate the community about hospice care?
There are so many misperceptions that people have about hospice, and as you said, it is something that people don't talk about until there is some sort of family crisis. There is a severe need, and that is not a time when it's easy to learn information and understand. So if people have these conversations earlier, when they can sort of absorb it and know more about it, they'll be better prepared when the time should come.
A little more clear-headed.
A little more clear-headed.
So do I understand that one of the misconceptions that you run into a lot is people think it's only for cancer patients?
Indeed. Hospice started way back in the 70s or 60s even, with the idea that this was for cancer patients whose disease had come back. And although we do care for people with cancer, increasingly we see patients with all kinds of diagnoses. We have frequently patients who have end-stage dementia, heart disease, lung disease, and even children, which is another myth. People don't think of children on hospice, but sometimes children with congenital abnormalities. There's a whole host of different conditions that have an end stage to them where people can avail themselves of the hospice services.
Yeah, and I think another misconception is that you have to leave your home and go into hospice care at a facility.
Yeah, and here on the shore we have Coastal Hospice at the Lake, which is a beautiful facility for those times when pain or symptoms are out of control, but people see that unit and they think, oh, hospice, I don't want to go there. Most of what hospice does is in people's own homes. We also serve people in nursing homes who are living there or living in assisted living facilities. So wherever you call home, that's where 99% of what we do is delivered.
Yeah. I don't know how to say this, so I'm just going to spit it out. Do you have to be close to the end for hospice care?
So for the hospice benefit, the way Medicare, Medicaid, and insurance kind of define it, you have to have a condition that's life-limiting, and the physician has to feel that they would not be surprised if they heard that you passed away within 6 months. That does not mean that you have to be gone in 6 months.
Right.
We often have people on service who live for a year. The far more common thing is that people wait for the referral and then they're on our service for a very short time. And if we're going to do our best work, it's really best if we're with a family for months, because we can provide a lot of support to that family and a lot of help if we're able to really do what we can do with our chaplains, our social workers, our volunteers, creating friendships, all of that good work.
And talk to us about when it's appropriate to reach out for hospice care.
Well, again, someone with a life-limiting condition, they're finding that trips to the hospital have become more frequent. Maybe they don't feel quite as good as when they went in the hospital when they come out. They're not seeing the improvement. Ask the doctor, call us. You don't even have to wait for a doctor to refer. Anybody can make the referral, and then we'll talk with the doctor and sort that out if it's time or not. Again, we do so much help for the family. We are available 24 hours a day, 7 days a week. So oftentimes it might be the spouse or the caregiver who really needs to know that they can call and we're there at 2 in the morning. You know, and that may be why they need us.
So hospice doesn't mean you're giving up hope?
Absolutely not. We continue to provide all the medications and treatments that somebody needs to control their symptoms. And for someone to have hope, they really have to have realistic expectations, or else it's false hope. And what we find is that people, when they know what their situation is, they redefine hope into something really meaningful for them. It might be the hope to see the grandbaby born. And those things can happen. Or it might be the hope to make it to the next birthday. Or it might be the hope to make it to the beach one more time, and we can help people with those experiences.
And you even see people graduate from hospice.
We do. We do. Nobody has a crystal ball, and so nobody really knows when that, artificial 6-month time frame is. So sometimes people come on service and they do very well, and they start to improve with the care that we deliver and help the family to deliver. And so they will come off of service for a time. We'll keep in touch with them through our Compass program, and hopefully before they have some other, before the condition gets bad again, we'll be able to bring them back on hospice.
Okay.
But yes, people do graduate.
Okay, so that day finally comes, and you can help with bereavement as well.
Absolutely. We follow all of our families in bereavement for 13 months, and if the death has been that of a child, for longer than that. And we have an event coming up tomorrow in Ocean City. It's open to the public. You do not have to have been one of our families that hospice served in order to attend any of our bereavement events. But tomorrow we have an event at the Ocean City Pier, fishing pier. And that is from 3 to 4, and it's going to be a ceremony where the families will participate by writing the name of their loved one on a shell, and we'll go out to the pier, and there will be some music and some inspirational readings, and then one by one people will throw that shell into the water.
What a great idea.
Yeah. Yeah.
Elaine, thank you so much for coming in and talking
Thank
to us.
you for
very,
inviting
very interesting.
me.
A lot of
Thanks.
misconceptions that you cleared up today.